I'm going to talk to you about how I perceive volume in terms of the importance, but it's going to be a little different how I do it compared to fat. So, you've seen some of my results for fat grafting. Well, there's all the different places we can put filler materials, but I want you to focus on three specific areas, because I think they give you the most bang for your buck and highest patient satisfaction, in my opinion. The periorbital area around the eyes, the anterior malar depression, specifically the malar septum. I'm going to talk to you about linear filling of that area. So even though I'm a pan-facial volume guy, I don't do pan-facial volume with fillers because it's too expensive and you don't get maximal benefits. And jawline contouring in the pre-jowl. So those are the three specific areas we're going to talk about and some options how to do it. Here's the thing, as facial plastic surgeons and plastic surgeons, we're not really taught how to do a good dental block. I used to go and search up these infraorbital nerve and got inconsistent blocks. This is fantastic. It's probably the best thing I can teach you the whole weekend. And it works beautifully. They are completely numb and they don't even feel my block go in. So what are the two options I use? I use one of two options. I look at periorbital hyaluronic acid and mid-face pre-jowl radius. To me, that is the least expensive, best options. I don't like my patients spending over $2,000 for fillers because no matter what you deliver, if you charge $4,000, it goes away, because these things have variable longevity. I think you're asking for particular problems. If someone says, since I do fat, I like to give the patients reversibility, because once they've had it, they go, God, I know what fat looks like, I want it. Then I will give them the option to do more of a complete hyaluronic acid profile, where I'm using either Restylane or Juvederm Ultra around the eyes, and then Ultra Plus around the pre-jowl cheeks, and I've got to use 2 syringes to get the results. It's a little bit more expensive, but it gives me the option of reversibility, and that's a nice option to have. So I don't use Sculptra, and I have done it in the past, and part of the reason is that it is expensive and it takes a lot of treatments. People coming in for an office treatment want immediate results, like yesterday. And I find it's imprecise in the periorbital area, and it's uncomfortable doing pan-facial work because it's outside my block. So I'm going to show you everything where you can actually stay completely within your blocks and get great results and target your volumes. Don't just put it everywhere. Target your volumes. And I'm going to show you that in my before and afters in a moment. So I honestly, as a pan-facial guy up here, you heard me talk about pan-facial volume. I don't do pan-facial with injectables. I target it. So you're going to hear a little bit different strategy from me. So here are my two options. My ideal option is HA around the eyes and radius, because radius gives me longevity and it's a little bit less expensive for being able to use a 1.4 cc syringe, but it doesn't give me reversibility, which is a problem in my field because I do a lot of fat grafting, and some people want to convert and they can't with hydroxyapatite. So again, breaking it down, periorbital and pre-jowl and cheek. The periorbital, I use blunt cannulas, transcutaneous approach to the mid-cheek, and I'm putting about half a syringe per side if I want a very modest result, but I really like to go and put a whole syringe of either Juvederm Ultra or Restylane around the eyes. So this is the other alternative. This gives me complete reversibility. I usually wind up, if I'm going to use the Ultra Plus, using about a half a syringe per cheek and a half a syringe per pre-jowl to get a result, whereas I could do that with 1 syringe of radius. Here's some of my results. This is a lady that came to me 2 weeks before her daughter's wedding and said, you know what, make me look great. Well, she wanted her lines filled. Guess what's the only place I didn't fill for her? Her lines. What I did was I targeted the anterior malar depression and the periorbital. I did a Restylane CC on each side, Juvederm a little bit into the lips, a drop into the pre-canine, and then I did the Juvederm Ultra Plus into the anterior cheeks and jawline. Now, if you see, she's got a little bruise on the left pre-jowl. And actually, I don't know if you guys have known this, but with a little IPL or laser, Ed Williams talked about this, you can actually just knock out that bruise within 48 hours. So my patients, I was not worried about doing this 2 weeks before a wedding. This is she at about 3 months out, and you can still see a pretty good hold of that. This is a 35-year-old. I want to do fat grafting for her, but she had no fat on her body. So this was just Restylane around the eyes and radius into just that anterior linear depression and nothing into the pre-jowl. This is a lady, it's an interesting story. She came to me really tired on the left and was halfway through her vacation week, so to speak, or looked tired. So this is Restylane around the eyes, radius into the cheeks and jawline. And the photograph taken on the right was taken after 10 straight days of working on the airlines, and she still looks more rested. Here's a problem that I would encourage you to think about. I don't know if you saw on the previous slide, the first instinct when you look at that left upper brow, it's heavy and it's hanging and it's hooded. You know, if you did something surgically, maybe you would lift it. But I want to convince you of one thing. Yes, the brow is maybe still heavy, but the reason your eye perceives that brow as heavy is that the lower eyelid cheek is empty. And what doesn't exist in nature in a young woman is an empty mid-cheek and a heavy brow. Once you start pushing the cheek and the lower eyelid out, your eye doesn't perceive the brow as heavy. And that's sort of an interesting comment. And look at each one of these. I don't know if you noticed that, but you don't see the hooding as much because your eye doesn't visualize it as heavy once you create balance and harmony to the face. There's another lady, if you see, again, volume slims the face. You can actually see that she looks slimmer after I added volume to the cheeks and I add volume into the jawline. This is Juvederm Ultra to the eyes. This is Radius into the cheeks and jawline. And you can actually slim down the face with adding volume. 38-year-old lady here who's been filling her lines with Restylane for 5 years and seeing no change. Well, I just filled her lower eyelids with Juvederm, and I filled her cheeks and jawline with Radius, and blam. And you can see how the nose and the eyes have balance now. When you look at that, it pulls a wide face and slims it down. That's what's so powerful with effective volume. And there's a gentleman, this is Juvederm around the eyes, Radius just to the cheek. So that's 0.7 cc's of Radius into each cheek and 1 cc of Juvederm into each eyelid. And I took this photo. The previous photo was taken 2.5 years ago. I forgot to take his before. And I start now taking my Botox photos after a year to two. Look at what Botox did after 2.5 years on his forehead. And I haven't been doing, he likes this character line. But to me, that's just amazing. I mean, I started taking all my photos long-term Botox to show the reversal. But again, look at his upper eyelid. If you look at his upper eyelid on the left, it looks heavy and hanging, and you don't see that as much on the right. Once you pull that mid-cheek and lower eyelid out, it starts to create more balance, and your eye doesn't see the heaviness. This is, I did fill her labial mandibular folds. This is one vial of Radius into the cheeks jawline, an additional 2 of the little 0.3 ones into each labial mandibular fold, a 0.3 Radius into each labial mandibular fold, and then this is Restylane around the eyes. So you can see, again, nice volume shaping. I think that the nasolabial fold is overrated. The labial mandibular fold makes someone older. The nasolabial fold, in my opinion, is the last thing I'm going to treat on the face. My first goal is actually cheeks. My second goal is under the eyes. My third goal is pre-jowl, unless they're heavy. And my next goal is my labial mandibular fold. And my final thing, if they've got extra money and want to do a little bit more, I'll do their nasolabial folds. But I think it's been totally overtreated because it's not an area that creates an aging phenomenon. So in summary, I really like to use fillers for volume. I think it's powerful. It gives a good impression of patients to understand what fat is all about. And I have found that Restylane Juvederm works well around the eyes, and Ultra Plus for a reversible option, Radius for not. And I love using blunt cannulas around the eyes. I think it works tremendously well. Thank you.